Now, 36 countries have authorized the use of booster shots to fight the Omicron variant. However, the World Health Organization remains extremely concerned about the efficacy of vaccines against the new mutant Omicron variant. In the latest study, researchers have found that antibodies developed by vaccines reduce more than 50% after just 6 months of the second jab. The study has further said that the number of antibodies developed in response to the vaccine will be determined by a person's age or sex. The people who are younger than 65 years have double the level of antibodies in comparison with the people who are 65 years and older. Vaccines reportedly also work better on women due to the X chromosome carrying some specific immunity genes. Meanwhile, the researchers also studied the risk of reinfection over a span of 6 months. In the pre-Omicron era, prior infection afforded 85% protection against a second COVID-19 infection over 6 months due to the developed immunity against Omicron. And this protection from reinfection has now fallen to just about 19%. The study shows as to how fully vaccinated people may need booster shots to prevent an Omicron infection. The yet-to-be peer-reviewed study looked at data from nearly 780 healthcare workers in the age category of 21 to 75. The workers were administered with 2 doses of the Pfizer vaccine. Their antibody levels were studied on 3 separate occasions: before the vaccination, after their second dose of the vaccination, and also as a part of systemic monitoring post 6 months after the second dose of vaccination. These findings have highlighted the waning effect of immunity provided by the vaccines. The findings also suggest that booster shots could in fact help retain the immunity 6 months after the second vaccine jab. However, a new study by the United Kingdom's Imperial College in London has highlighted as to how the risk of reinfection by Omicron is drastically higher than the risk of reinfection posed by the earlier strains. Now, the study compared the risk of reinfection by Omicron and Delta variants, and the study says that a booster shot actually increases protection against symptomatic Omicron by 55 to about 80%. At the same time, the risk of reinfection by the Omicron strain is about 5.4 times greater than that of the Delta variant. The latest modelling points out that the Omicron variant largely evades immunity from past infection or even 2 vaccine doses. And this is something that is extremely worrying for research analysts who at this point of time are looking as to how Omicron still continues to spread amongst the people. WION is now available in your country. Download the app now and get all the news on the move.